She moved through the ER like she wasn't there at all. Head down. Steps quiet. Nobody looked twice. They called her Nurse Ellis. Nobody knew that wasn't her real name. For 6 years, she had buried a life most people would call impossible. 2 tours. A call sign she hadn't heard spoken aloud since the day she came home. A prosthetic leg hidden under scrub pants and a limp she'd trained herself to disguise as nothing more than a bad knee. She had learned the fastest way to survive was to make herself small. Then, on a Tuesday morning in October, a gurney crashed through the doors with a name on the patient's dog tags that stopped her cold. A name only she should have recognized. Before we get into what happened next, welcome to Silent Heroes. If you're watching this from your car, your kitchen, or your night shift break room, drop a comment and tell us where you're tuning in from. And if you think you know why that name mattered, guess in the comments before the reveal. Now back to the story. Nurse Grace Ellis was 29 years old, according to her file. Brown hair, always pulled back tight. A faint white scar along her jaw that she never explained. Her hands were steady in a way that unsettled people, though nobody could say exactly why. She worked the overnight shift at Ashland Memorial, a mid-sized hospital in a mid-sized city, the kind of place where nothing extraordinary was supposed to happen. She liked it that way. Predictable. Quiet. Invisible. Every morning she pulled on her scrub pants over the prosthetic below her left knee, checked the socket fit, and told herself the same thing she'd told herself for 6 years. Nobody needs to know. The man who ran the ER did not make that easy. Dr. Marcus Whitfield was chief surgeon at Ashland Memorial, and he wore the title like a crown. He had a habit of correcting nurses loudly, in front of patients, in front of families, because he believed humiliation was a teaching tool. Ellis, when I want a second opinion from someone who didn't finish nursing school in the top half of her class, I'll ask for it. He said it almost weekly. She never answered back. There was one person at Ashland who saw past the quiet act. Old Mr. Halloway, a retired mailman who came in twice a month for his heart condition, always requested her by name. "You walk like someone who's been somewhere, Ellis," he told her once, squinting up from his hospital bed. "Somewhere hard. I don't know where. But I see it." She'd smiled and changed the subject. He hadn't pushed. But he remembered. Nobody knew that 6 years ago, Grace Ellis had a different name, a different rank, and a different kind of steady hand. At 6:14 in the morning, the ambulance bay doors burst open. Multiple GSW. Male late 30s. BP crashing. The gurney tore through the hallway, a trauma team scrambling behind it. Whitfield took charge immediately, barking orders, radiating the kind of confidence that looked like competence and wasn't. "Start him on standard fluid resuscitation, 2 liters, wide open," Whitfield ordered. Grace's stomach dropped. Standard fluids, wide open, on a patient this unstable. It would dilute his clotting factors and push him straight into hemorrhagic shock. She stepped forward. "Sir, with respiratory rate this elevated and pressure this low, permissive hypotension protocol would." "Nobody asked you, Ellis." Then she saw the tags around the patient's neck. Not the dog tags. The ID bracelet from a VA hospital transfer, printed with a call sign instead of a name. Reaper 6. The word hit the room like a detonation. Her breath caught. Her hands, for 1/2 second, trembled. "You know this patient?" Whitfield snapped, catching the look on her face. She said nothing. "Answer me, Ellis." Still nothing. The silence stretched, heavy and deliberate, while the monitor behind them screamed a warning nobody else seemed to hear. She stepped past Whitfield without asking permission. "He's bleeding internally. Not externally, you won't see it. Cullen's sign is starting at the umbilicus. That's retroperitoneal hemorrhage. If you flood him with fluids now, you kill him. Get her out of my ER." She didn't move. Her spine had straightened. Her voice had dropped into something flat and certain, a register nobody at Ashland Memorial had ever heard from her. "No. I am just done hiding." She grabbed the ultrasound probe herself, hands rock steady, and pressed it against his abdomen. Fast exam. Focused assessment with sonography for trauma, a fast bedside scan used to check for free fluid in the abdominal cavity within minutes, without waiting on imaging that could cost a patient his life. Free fluid pooled dark on the screen exactly where she expected it. Splenic rupture. He needs now, not fluids. The room went still. A resident's mouth hung open. Whitfield's face went red with fury and something else, fear of being wrong in front of witnesses. You're suspended, Ellis. Effective immediately. Security. Call them, she said. I'm not leaving this patient. The crowd of staff gathering at the doorway had stopped looking at Whitfield like a leader. They were looking at her like something else entirely. The doors at the end of the hallway swung open before security ever arrived. 2 men in uniform walked in, flanked by a woman in a dark suit carrying a government ID clipped to her jacket. The lead officer scanned the room once, found Grace, and stopped moving like he'd seen a ghost. Captain Ellery, he said. It's been a long time. Whitfield blinked. I'm sorry, Captain who? The officer ignored him entirely. He turned to the room, voice carrying, formal and unhurried. This woman is Captain Grace Ellery, United States Army, retired. Combat medic, 2 tours, Silver Star recipient. She ran forward surgical teams under fire in conditions most trauma surgeons in this country will never see in their careers. The patient on that table is her former unit commander. He was flagged for transfer to this facility an hour ago under a classified protective order. The room went silent except for the monitors. Whitfield's face drained of color. There's no record of that in her personnel file. There wouldn't be, the woman in the suit said. Her file was sealed at her own request. She didn't want special treatment. She wanted a normal life. Whitfield opened his mouth, closed it, opened it again. I was following protocol. I didn't know. You didn't ask, Grace said quietly. You never asked. You just assumed I was nothing. Hospital administration arrived within the hour, and it didn't take long to see the truth of what had really been happening at Ashland Memorial. Whitfield's real motive had never been about patient care. Buried in a cabinet in his office, investigators found a folder of falsified trial data, a lucrative drug study he'd been quietly steering, cutting corners and burying complications to keep the funding flowing. The near-fatal fluid resuscitation order wasn't just bad judgment. It matched, almost exactly, the flawed protocol from his study. He'd been testing it on real patients without their knowledge. He was still holding that folder when 2 hospital security guards escorted him toward his office to collect his things, and that's when he snapped. He grabbed a scalpel off a supply cart and lunged, not at Grace, but at the government liaison holding the evidence. Grace moved before anyone else could react. 6 years of training didn't disappear because she'd spent 6 years pretending it had. She caught his wrist, twisted, and had him on the floor in under 2 seconds, the scalpel skittering harmlessly across the tile. Don't, she said. Just that. One word. 2 officers pulled him up and out of the room in cuffs. Back at the bedside, the real fight wasn't over. Her old commander's pressure was dropping fast, and the surgical team was already prepping the oar. BP 82 over 50, a resident called out. Dropping. Get him up now, Grace said, walking beside the gurney, hand pressed to his shoulder. His eyes fluttered open for just a moment. Recognition flickered through the pain. Ellery, he rasped. Knew you'd be here. Save it, she said, throat tight. Tell me after. Tell your brother, he whispered. He didn't die for nothing. Her breath caught. Her brother, gone 8 years now, the reason she'd enlisted in the first place, the reason she'd buried this whole life instead of building on it. Heart rate 140. Sats dropping to 88. Move, Grace said, and they moved. The surgery took 90 minutes. Grace waited outside the OR doors, still in her scrubs, prosthetic aching from a full day on her feet, hands finally, quietly still. When the surgeon came out and gave a small nod, She let out a breath she felt like she'd been holding for 6 years. "He has a chance," the surgeon said. That was enough. 3 weeks later, Marcus Whitfield's medical license was formally revoked. The falsified trial data led to a hospital-wide review and a criminal investigation. Ashland Memorial issued a public apology and, under new leadership, named a policy after the incident: the Ellery Protocol, a mandatory second opinion review for any attending physician's trauma orders. Grace wasn't just reinstated. She was offered something new: director of a trauma training program for combat medics transitioning into civilian hospital work, teaching the next generation of nurses how to bring both halves of themselves into the room instead of hiding either one. On her first day in the role, Mr. Halloway came in for his regular checkup and found her in a new coat, a small pin on her collar reading Director of Trauma Education. "Told you," he said, grinning. "Knew you'd been somewhere hard." "You were right," she said. "About all of it." She didn't hide the limp anymore. She didn't lower her eyes when she walked down the hallway. The tremor that used to live in her hands whenever someone said her old rank out loud, it was gone now, and it wasn't coming back. Grace Ellery had spent 6 years believing that hiding was the only way to survive. But surviving and living, she learned, were never the same thing. The strongest people in the room are rarely the loudest ones. They're the ones quiet enough to be underestimated, and steady enough to prove everyone wrong when it matters most. If this story moved you, hit like and subscribe to Silent Heroes for more. Comment below, what would you have done if you were in that ER the moment the word Reaper 6 hit the room? The next story is already waiting. The end.